Welcome to another episode of Fertility Talk with Olarunke Thaddeus. When a woman is born, she is born with all the eggs she would ever have. And as she matures, falls into puberty, she begins to lose those eggs every month during menstruation. And by the time she gets towards menopause, by the time she approaches menopause, the eggs reserve is almost finished. So this brings me to the topic of today, ovarian reserve. Yeah, I know you're interested. It's a very important topic for all women, whether you're young, you're old, or you're in between, or you are still within reproductive age, then yes, please listen and watch this episode. What is ovarian reserve? Ovarian reserve refers to the numbers of eggs, the amount of eggs you have left to make babies. To a very large extent, your fertility depends on the quality and quantity of the eggs in your ovary, as well as the ovarian follicles that you have. The way your ovarian follicle responds to hormonal signal in your brain. Okay, so and all these are determined by a lot of factors. Ovarian reserve, like I said, is one major factor that affects infertility, especially when it starts diminishing. In the absence of every other infertility factors, ovarian reserve is one of the major predictors to your fertility, as it borders on the eggs in your ovaries. Because if there is no egg in there, then there is no way pregnancy can occur. So what happens when there is a diminished ovarian reserve? Diminished ovarian reserve occurs when a woman loses her reproductive potentials. Okay, and before a woman can get to this stage, then there are factors that could cause this. One on my list is age. Age is a very important factor when it comes to diminished ovarian reserve. Okay, a younger female is said to be at the peak of her reserve. Okay, I would like to liken ovarian reserve to a water tank. Okay, a water tank that has a capacity of say 400,000 liters. And by the time you are in your 30s, yes, you still have as much as 27,000 liters. Okay, and by the time you are approaching menopause, what is left is about 1,000 liters. I'm just using liters. It doesn't come in liters. Okay, it's not calculated in liters, but I'm just using liters so that you can understand what I am talking about. Okay. So age determines how well or how diminished your ovarian reserve is, okay? Because like I said, you menstruate every month and you keep losing your eggs as you menstruate. So the younger you are, yes, the chances are that your reserve will still be full. And the older you are, yes, the very chances are that your reserve would almost, be empty or almost diminished. So let me not use empty, diminished. Okay, so age is a very, very important factor, and age is number one factor that could make you to have a diminished ovarian reserve. And this is why this topic is very important for every woman, because you need to realize, you need to know that age is a very important factor for women, especially because we have limited amounts of eggs, and we are losing them also. They are not just static there. We are losing it every month. Okay. So another factor that could make you to have a diminished ovarian reserve is if you have done ovarian surgery before. Yes, women that have undergone ovarian surgery would definitely or most likely have issues with their reserve. Okay, Another factors that could make you to have a diminished ovarian reserve is cigarettes. If you are a smoker or you stay around people that smoke, then this will be affecting your reserve drastically. So please, you have to watch out. If you're a woman, please, smoking is a no-no, okay? So watch out and make sure you're not staying around smokers, as this has been proven to affect your ovarian reserve. Some drugs also affect ovarian reserve. Some drugs can make a woman to have a diminished ovarian reserve, especially cancer treatments, radiation. You know, all this exposure could make someone to have a diminished ovarian reserve. Of course, genetics is also there. Some younger females would just have their ovarian reserve reduced just for no reason. They could be born that way. Yes, there could also be idiopathic reason where there is no just reason for having a diminished reserve. You know, it could just be you're born that way. But we have some genetic reasons as well. Maybe hereditary, or you know, that could make a woman, so someone, to have a reduced ovarian reserve, a diminished ovarian reserve. Technically speaking, you might not know you have a diminished ovarian reserve. Some research has identified reduced menstrual cycle from 28 days to 25 days as an indication, but truly this could just be an indication to so many other issues, okay? So I won't really lay emphasis on that. But in the real sense of it, medically speaking, if you want to know if you have diminished ovarian reserve, then you need some tests. You need to run some tests. Number one on the list is transvaginal scan. So you have a transvaginal scan done, okay? So a probe will be passed into your vagina and your ovaries will be looked at, okay? You should have some numbers of follicle at a particular time in your cycle. So by the time your doctor is scanning you and, you know, he or she asks you what day of your cycle is, and, you know, it doesn't correspond to the follicles you have, then you could recognize that, yes, there could be an issue. And also, this would inform him to run other tests for you. Another test, again, you could do to check if you have diminished ovarian reserve, or just to check your ovarian reserve, is follicle stimulating hormone, FSH, okay? With FSH, you would have an indication. It would just indicate what's like an indication that's, yeah, you're fertile. Another test you could do to know if you have ovarian reserve is estradiol. Estradiol is to check the level of your estrogen, and both estradiol and FSH are good indicator to your fertility. Mark my word, I said indicator, but I've actually seen instances where FSH really contradicts AMH, okay? And this is why, for me, one of my major tests that I would recommend for every woman watching this video to go and do is AMH, anti-Mullerian hormone test, AMH, okay? So AMH will tell us the level that your ovarian reserve is, okay? For instance, if your tank has reached, for instance, if your tank has reached, say, 2 liters or 27 liters or 40 liters, AMH is beautiful. It would tell you exactly what the tank is saying, okay? So if you're watching the video, if you want to do your AMH, please let me know. And if you've done it, send your results to me. You can share with me. I will look at it together with you. So how do we treat diminished ovarian reserve? Unfortunately, there is no treatment for diminished ovarian reserve, because, like I said earlier, we were born with all the eggs we have as a woman. So once it's once it's gone, it can't be replaced, okay? Because as we age, we lose our eggs in quality and in quantity, okay? So there is actually nothing we can do. But if you have checked your ovarian reserve and you are in your 30s and you're not married, then what you can do is to preserve your eggs, okay? Because if you don't preserve your eggs, then by the time you're ready to have babies, there will be no eggs for you, okay? So, and to preserve your eggs, you will need to do in vitro fertilization. You will need, your ovaries will need to be stimulated so that your eggs can be retrieved and be freezed for you, okay? So this is the end of the topic. I hope you enjoy my discussion today. Thanks for watching another episode of Fertility Talk with Olarunke Thaddeus. Kindly subscribe to my YouTube channel, and if you have further inquiries, please comment below, and you can also book your appointments to see me as well. Thank you. Don't forget to also follow us on Instagram. Thanks.